Hello, and welcome to the third lecture in our immune disorder lecture series. And today we'll talk about autoimmune disorders. And we can kind of categorize these disorders into a couple of ways. We can say organ specific or systemic. Organ specific obviously would be a disorder in one specific organ, whereas systemic would be everywhere. These kind of manifest on the skin in that kind of way. And you can have inherited or acquired. Okay, those kind of make sense as well. If you inherit it, it's more likely a genetic defect, like we'll see with severe combined immunodeficiency disorder, and acquired, which is the HIV infection, okay, human immunodeficiency virus, and how that can lead to AIDS, which is acquired immune disease. And so, yeah. So those are the categories that we can see about our autoimmune disorders. And in some organ-specific autoimmune disorders, we can see that celiac disease would be one of those. Celiac, of course, is when you can't eat gluten, and it will not be tolerated by the small intestine. Graves' disease, another organ specific to the thyroid organ, and if it's hyperthyroid, it's going to get big. Okay, so a big thyroid, you can imagine what would happen. Okay, Hashimoto thyroiditis. Okay, hypothyroidism. Okay, so that's shrinking of the thyroid. Type 1 diabetes, where you don't produce insulin. And Addison's disease, okay, are all organ specific. Okay, and just like we said, if Graves' disease causes hyperthyroid, then you will get a big goiter. Okay, symptom of Graves' disease and Hashimoto thyroiditis. Okay, you'll get these goiters. And another symptom of Graves' disease is exophthalmia. Okay, exo meaning out of. Okay, not endo meaning into, or meso meaning in between, but exophthalmia. Okay, so these two symptoms together would tell you that you have Graves' disease, a problem in your thyroid. A Another autoimmune disease in the organs is Addison's disease, where you get hyperpigmentation. Okay. And then we have our systemic autoimmune diseases. We saw multiple sclerosis was a type 4 hypersensitivity, and rheumatoid arthritis and lupus were type 3 hypersensitivities. 4 and 3. All right. And so these are systemic versions of them. Okay. Myasthenia gravis. Okay. Normal release of neurotransmitter stimulates muscle contraction. But in myasthenia gravis, they are going to block those receptors, resulting in no muscle movement, paralysis. Okay? Paralysis. No muscle movement, no movement, paralysis. Okay? Rheumatoid arthritis is another systemic disease, and this is unfortunate when your joints will start to kind of bend in on themselves, as pictured. Lupus is also our systemic autoimmune disease, and it is a type 3 hypersensitivity, where you can get facial rash like our pilot did, but you can also get inflammation of the pericardium, okay, poor circulation in the fingers and toes, which is that anemia we talked about. And if you're getting inflammation in the pericardium, you might get blood in your urine, like our Carrie pilot did. Another example of a systemic autoimmune disorder is DeGeorge syndrome, and this is an inherited one because it is a deletion syndrome, deletion referring to our chromosomes, and so these will basically cause rheumatoid arthritis or Graves' disease. And here we have a big chart, okay? Addison disease, celiac disease, Graves' disease, psoriasis, rheumatoid arthritis, lupus, okay? And check out lupus, systemic lupus erythematosus, okay? Urethra means red. Lupus, you get the red rash along your cheeks and nose, okay? So lupus erythematosus, okay? So go ahead and check out these signs and symptoms and causes, okay? Don't try to like rote memorize this list. Try and go back to a picture and associate what might be happening with each thing, okay? So celiac disease, okay? It obviously can't digest gluten, so what's gluten going to do if gluten interacts with something in your small intestine? Well, that kind of makes sense, right? Upset tummy, abdominal pain, okay? And if you can't digest all the stuff you're eating, malnutrition, okay? So kind of think about these things in terms of what would happen if, right? So what would happen if your fingers start moving like this, right? You're gonna have joint inflammation, pain, disfigurement, chronic systemic inflammation. So that's why associating it with the pictures will help, because you can kind of see, oh, rheumatoid arthritis, rheumatologist, right? Joints. So keep all of this in mind as you look over these disorders. Yes, it's a lot, but you can kind of use our social cues too, because we've heard of psoriasis, multiple sclerosis, celiac disease, and lupus. We've kind of heard of all these already. Okay, immunodeficiencies. Apologies for the misspelling there. But we can have primary and secondary immunodeficiencies. Okay. Chronic granulomatosis disease, IgA deficiency, severe combined immunodeficiency disease, okay, and X-linked gamma glumia. Okay, point is we have HIV on this list too, malnutrition, okay, and therapies, okay. So you can see all those secondary immunodeficiencies are caused by you living, right? Malnutrition, you not getting enough energy, viral infection, you acquiring a sexually transmitted disease, immunosuppressive therapies, you had to treat yourself with chemotherapy for another disease, okay? All of these can lead to impaired humoral responses and impaired other immune responses, right? And so if we impair those, we will get opportunistic infections, okay, and rare cancers. All that kind of makes sense, right? If we get something bad, if something bad happens to us, we can shut things and systems down, okay? Whereas the primary ones are gotten from another source. If you have IgA deficiency, that means you're not producing IgA, and your tears and your mucus won't be fighting infections, they'll be just trapping it. And so there we go. We're going to just trap the infections in our lungs and give it a nice place to stay. No IgAs, we're not going to destroy it, and so now you're going to get lung and GI infections. Okay, so primary and second immunodeficiencies. SCID is a big one they like to push in immunodeficiencies, okay, because this is Bubble Boy. There's a movie made on Bubble Boy, probably more comical than what actually happened, but he had a severe combined immunodeficiency disorder in which he had no humoral immunity and cell-mediated immunity, and so anything could get him sick. Eventually, he got a blood transfusion from his sister, who had a rare virus that she didn't know about and wasn't really sick from it, and he ended up dying. Very tragic. Okay, and then finally we have cancer immunobiology and immunotherapy. Kind of very basic topics here. We're going to just touch on them. Okay, so we can have cell-mediated response to tumors, where we actually try and eliminate the tumors through our cell-mediated response. And also we have available cancer vaccines that will prevent cancer. Okay, and that is notable for our HPV vaccine, all right, or human papillomavirus vaccine. All right, and so that is our immune disorders lecture series. Hope you enjoyed it, and that will conclude Unit 3.